Hello, I'm Ed Vitale. I work in the University of Leeds. I'm chair of the Lupus Forum, and welcome to our Lupus Forum daily highlights for ACR 2022. I'm delighted to be here in Philadelphia to bring you ongoing coverage of the lupus content during the Congress. Each morning, we're going to be posting these daily highlights to point you to my chair's picks of the content, as well as posting on our social media channels during the day as we attend sessions. So make sure you follow @Lupus Forum on Twitter and on LinkedIn to keep up to date on all of our activities during the weekend. So today, my chair's picks all come from the treatment poster 1 session, starting at 1 o'clock. First, we've got Emma Materne et al. Presenting on the comparative risks of infection with belimumab compared to oral immunosuppressants in non-renal lupus. Some reassuring data there, with infection rates looking very good on belimumab in comparison to the other agents that we usually use. And also on belimumab, our steering committee member, Maria Dalera, and colleagues are going to be presenting the effect of belimumab on kidney outcomes in SLE. And that's including results not just from the lupus nephritis trial that we saw published recently, but from the nephritis outcomes across all of the phase 3 program. And continuing the lupus nephritis theme, also in this session we've got 2 abstracts on the use of voclosporin in lupus nephritis. One of them's from Amit Saxena et al., and that's on the results in class 5 patients in the Aurora 2 continuation study. So if you treat class 5, you know how difficult it can be to control the proteinuria, and that calcineurin inhibitors may be useful here, and this is showing that more patients can get less than 0.5 on a urine PCR. The other one is from Ellen Ginsler and colleague, and that's on long-term safety and efficacy in Hispanic and Latino patients, because we know that ancestry and ethnicity can be very important predictors of outcomes in nephritis trials. My final picks of the lupus content today are both on novel therapies in SLE. So my friend and Lupus Forum steering committee member, Rich Fury, and his colleagues are presenting the results of the LILAC study part A. That's litifilimab, targeting BDCA2, drug that we used to call BIB059, and data on joint and skin manifestations, particularly on the arthritis content in that paper. And if you go on our website, lupus-forum.com, you'll find another discussion there with the 2 key authors of these 2 papers, Rich Fury and Victoria Worth, where we discussed the trial in great detail. And finally, I'd like to point you to the phase 2 results from Megan McKay and colleagues on JBT101. Again, there's a lot of arthritis data in here, and one thing that's nice is they don't just look at SRI-4, but they explore a lot of outcome measures, for example, pain scores done by the patients. You can find the full list of all the abstracts for all of these and for the whole of the Congress in our highlights brochure. That's available at lupus-forum.com, or you can pick up a printed copy if you come to our stand, number 1027. I hope you enjoy my picks today. I look forward to seeing you around the Congress. I'm going to be back tomorrow with some more selections of the key lupus content.